Good day, colleagues. My name is Mignon Hamman. I'm a general practitioner in Pretoria with a special interest in sleep disorders. This is a summary of a talk done by Dr. Picchietti on sleep-related movement disorders at the World Sleep Congress in 2022. So just a brief summary to help my colleagues. Enjoy, and I hope you learned something. Right, so understanding sleep related movement disorders in children is crucial as they significantly impact overall health and development. Sleep related movement disorders in children can disrupt sleep patterns, leading to potential developmental delays and affect overall functioning during the day. This review highlights the prevalent diagnosis and treatment approaches of SRMD in children, emphasizing the need for increased awareness amongst healthcare professionals. Understanding these disorders is essential to mitigate their long-term effect on children's health. Sleep disorders, including bruxism, affect a significant percentage of children, highlighting the need for awareness and a proper diagnosis. Bruxism is the involuntary grinding of teeth, and this is found to be more prevalent in individuals with sleep disorders. It is a common occurrence in children and often lead to dental wear and other associated health issues if unaddressed. Examples would include a TMJ syndrome and often teeth crowding. A significant population-based study conducted from 2007 to 2021 suggests that sleep disorders affect between 1 and 4% of all children. This is important to keep in mind when asking the parents about their children's development and sleep. Misdiagnosis of sleep disorders, particularly benign myoclonus of infancy, remains a significant concern, often leading to inappropriate treatments with antiepileptics. Benign myoclonus of infancy is actually a common diagnosis and misdiagnosed as epilepsy. Typically, these present as sudden jerking movements during sleep. They generally resolve by age 5 without any long-term consequences, requiring no treatment. This poses a challenge as there are very little sleep labs that are equipped to do polysomnograms and EEGs on children. Distinguishing benign myoclonus of infancy from epilepsy is crucial for appropriate management. Clinical history, the event characteristics, and the presence of developmental milestones help differentiate these conditions, preventing unnecessary interventions. Again, important to ask specific questions as the caregivers might not think to mention some of these symptoms or sometimes have not noticed them. The use of SSRIs in children with sleep disorders may worsen the underlying sleep-related movement disorders. This is also relevant as more and more children struggle with anxiety at a younger age and are put on antidepressants. Iron status significantly impacts sleep quality in children, linking neurological health with proper iron levels. Iron deficiency is an imitator of many other conditions and is very easy to treat. In South Africa, we specifically see a high percentage of patients with iron deficiency. The recommended ferritin levels in pediatric patients are above 50, and this is to support optimal neural functioning and mitigate sleep disorders. It is important to exclude other causes for deficiency. Malaria symptoms, for example, might be worse if you add iron. Iron supplementation is also not advisable in hemochromatosis if the iron saturation is more than 45 in the pediatric population. There seems to be association between the different conditions, and I think it's important to remember that patients can have multiple conditions with overlapping symptoms. A single-centered study in 2021 demonstrated comparable efficacy between oral and IV iron supplementation for improving restless sleep index scores. This is comforting as we often presume IVI treatment is better. In children, IV treatment is more invasive and unlikely then to be the first-line option. Restless sleep disorder has only recently been classified as a sleep disorder. This is a sleep disorder in children that involves frequent, large muscle movements during sleep. It can cause sleep disruption and daytime impairment. Further studies are needed to establish a definite link between iron supplementation and improvement in RSD symptoms. So, as a take home message, recommendation for pediatric practices as well as GP practices who sees children. The pediatric practitioner should assess iron levels in children presenting with sleep disorders and consider supplementation when the ferritin is below 50. It's also important to ask about comorbidities and other treatments, as SSRI's effects on sleep is essential to ensure safe management of affected children. Thank you for listening. I hope you found this interesting and useful, and you can take it home to your practice.